With funding from the United States Agency for International Development, USAID, Breakthrough Action Nigeria COVID-19 social and behavior change strategies are aimed at designing data-driven social and behavior change interventions to mitigate the impact of COVID-19 amongst people living with HIV who receive care and treatment services through PEPFAR supported facilities and their healthcare providers. To achieve this, Breakthrough Action Nigeria worked closely with key government stakeholders and PEPFAR implementing partners who already know the context and environment and provide care and treatment services to people living with HIV. Healthcare workers are key to successfully achieving the interventions that help achieve these objectives. We cannot do it without them. In their role at the front line, they need to protect themselves and their families. And at the same time, they play a key role in communicating to others about the importance of taking protective measures, including taking the vaccine while continuing care and treatment. To help achieve this, Breakthrough Action Nigeria worked with partners to develop a curriculum called Building Trust and Empathy. This is an approach to support healthcare workers to communicate with clients in an empathetic manner in order to improve service communication and ultimately encourage clients to take on protective measures, including the COVID-19 vaccine. At the national and subnational levels, Breakthrough Action Nigeria built the capacity of stakeholders and partners using the Building Trust and Empathy curriculum.
If you are able to put yourself in the shoes of the client, then you can see things the way they see it. And that will now encourage the client to assess health. The client will open up because he sees that you are seeing things from his or her own perspective.
The healthcare workers are the most trusted sources of information in their communities. Members of the community interact with them almost on a daily basis. Whatever information they give to the community, it is taken seriously. Once they get the right information, then the right information is what is sent out to the public. And if they are misinformed, then definitely we will see low uptake of the COVID-19 vaccination in the communities.
A few stakeholders who were involved in developing the curriculum talked about what was involved in developing and rolling it out. Following a training of trainers, Building Trust and Empathy was rolled out in several states.
We had to look at some medical doctors, nurses, case managers who are interacting directly with the PLHIVs at the different facilities, brought them together to do a pilot training that was facilitated by Breakthrough Action. We had a representative of NCDC to train those that were expected to step down the training. So about 50 persons participated in the pilot.
Before now, professionals focus more on those technical things in terms of drugs, in terms of getting diagnoses, and not considering the value communication brings to both prevention, detection, and response.
At PEPFAR-supported facilities in Adamawa State, the impact of the capacity development is being seen in vaccine uptake.
I was part of those that are thinking about those misconceptions and misinformation concerning the vaccine before attending the training. But after attending the training, now I come to understand that all the myths and misconceptions that is going around the society or community whatsoever is just fake.
Na karba COVID-19 vaccine don mi wani health worker ne yayi magana da ni shine na je na karba. Yace yana da kyau dai mutum ya karba don kariya. Yayi min shawara, ya bani shawara, na ce to wannan ba zai kawo min wani akasi a jikina ba. Yace a'a ba kyau, yana da kyau mutum ya karba wannan kariya. Shi ma'aikacin aikin asibiti ne, in ba shi ma'aikacin asibiti ba kan ba zan karba ba.
I have 167 clients under me. I have convinced 199, telling you that I have exceed my target client that are being assigned to me. That is to tell you that we have a very huge success.
Da farko sun bani tsoro wai mai BP ba zai yi ba, mai asthma ba zai yi ba, sannan mai ulcer ba zai yi ba. All these ones ina da su. So na ji tsoro. Amma daga bayan da ta zo ta enlighten ina sosai, ta ce in yi ba damuwa, so na yarda na yi. Approach nata yana da kyau. Even mun zanna ta min bayani dalla-dalla. Ta ce yi ta yi convincing ina yi ba damuwa da all these symptoms zai tafi.
The training was very nice and I was very happy because before I went to that training, I was among those that didn't accept this vaccine. But after the training, in fact, I even collect the vaccine. I was the one going around to tell the people to come and collect the vaccine.
At the PEPFAR-supported Comprehensive Health Center, AWA, in Ona local government area of Akwa Ibom State, Emmanuel is taking the COVID-19 vaccine. Emmanuel was encouraged by Dr. MM after Dr. MM used counseling skills learned through the Building Trust and Empathy training. Another client who has taken the COVID-19 vaccine following interactions with a healthcare worker trained on the BTE module is Mrs. Ekaite Alexander.
The man was me a man when he done COVID-19 and yellow. I was going to get a phone. So man uncle phone give him. Was it him for a
Like Mrs. Ekaite Alexander, other clients in PEPFAR-supported facilities in Akwa Ibom have accepted the COVID-19 vaccine. Healthcare workers spoke about how they have a better appreciation of their clients' experiences and are able to communicate with them more effectively about their concerns related to the COVID-19 vaccine.
We carried out a lot of campaigns during this time, and we went from community to community within the Ona LGA. They got to ask us things, their concerns, and we were able to give them feedbacks. Initially, we were at 106 persons vaccinated, especially people living with HIV, but with this rollout, currently in Ona LGA, we vaccinated over 4,000 people living with HIV.
Before, I used to find it difficult to talk more or press more further when a client declined from being vaccinated. Now, after the program, the training, I find it very easy to speak with clients and interact with them.
The Building Trust and Empathy is not complete without the session on the healthcare workers' well-being and mental health. Some of the healthcare workers share how they cope with stress at work.
I just go inside one room, sometimes just plug my AirPod, listen to just music for some while, then I'll just come back to work and then get going. That's how I've been able to manage my stress.
What I do is I find a special time for myself. I rest, I renew my memory. At times I just stroll.
A particular game in my phone I like once I sit down to play it, my mind, my brain, my system will just calm down.
The training on building trust and empathy amongst healthcare workers has been key to improving uptake of the COVID-19 vaccine amongst people living with HIV and their healthcare providers. This client-centered communication approach could hold the key to improving uptake of vaccines and other public health interventions across the country.
You need communication to help people know about these diseases, what they need to see to know they have this disease, to suspect because they can't confirm, they need to go to facility. And that's just as signs and symptoms, what they need to, where they need to report to get care and what they should not do to prevent further spread in the community.